Hi, my name is Lauren West-Livingston, and I'm here to talk about how to create gender-affirming encounters. I have nothing to disclose. A little bit about me. I just recently graduated from the MD Ph.D. program at Wake Forest with a master's in studies of law and health law and policy. I'm an incoming vascular surgery intern at Duke University. I am queer. My pronouns are she, her, hers, and I'm very passionate about equity in healthcare, medical education, and yeah, so that's why I'm here to talk about this. The objectives for this talk are: what is gender-affirming care? To define that for you, what terminology is important to know, affirming care for general medical practice, and affirming care for vascular surgery. So what is gender-affirming care? It's something that you might have heard in the news recently. The Association of American Medical Colleges defines it as a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity, particularly when that gender identity conflicts with what gender they were assigned at birth. So some examples of gender-affirming procedures, just to challenge what you may have heard or may think, things like breast augmentation, genioplasty, BBLs or Brazilian butt lifts that you may see on Instagram, gynecomastia surgery, rhinoplasty, hormone replacement therapy for menopause, and testosterone shots are things that you don't necessarily associate with trans patients, but do represent gender-affirming procedures in medical care. At the same time, for trans patients, things like counseling and resources, speech therapy, hair removal treatments through laser therapy or electrolysis, things like binding, padding, and tucking, hormone blocking or hormone therapy, and of course, gender-affirming surgeries, which people tend to focus on. However, all of these things represent gender-affirming procedures in care. Some terminology, something that is very important to tell the difference between gender identity or gender expression and sexual orientation. All those are different things. So anatomical sex is what is often assigned at birth, and you may be assigned female at birth or assigned male at birth. Gender identity is your internal cognition of yourself in regard to your gender that may or may not match with the gender you're assigned at birth. And then gender expression is what you choose to wear, how you express yourself socially, which again, may or may not match your gender identity or the sex you were assigned at birth. And sexual orientation is completely unrelated to these things. Someone may be asexual, in which they're attracted to no genders. They may have same gender attractions and may identify as gay or lesbian. They may have opposite gender attraction, identify as heterosexual. They may be attracted to a gender different than themselves and identify as bisexual, or attracted to all gender identities, and that would be called pansexual. However, this is not completely exhaustive. There are many other identities that are not represented here. Other terminology to be aware of: a cisgender person is someone whose gender identity is aligned with the sex they were assigned at birth. So you may see the terms transgender or cisgender. Also AMAB or AFAB, assigned male at birth or assigned female at birth. A dead name is the name that someone was assigned prior to their transition. You should avoid using people's dead names. And then transition. The transition can be a social, a legal, or a medical transition. It doesn't always involve surgeries. It can be coming out to friends and family or to employers. It can be legally pursuing name changes or illegally having gender changed on legal documents. And then of course, medical may involve any of the things we discussed earlier. So things that include affirming care for general medical practice. There is the creation of a physical environment welcoming to LGBTQ+ patients. So that can involve signage in your office and just letting people know that when they come into your office, it's a safe place for them. Medical visits for transgender patients can be a place that is not welcoming. It can be a place where they're disempowered. So keeping that in mind and making sure that you go out of your way to let them know that they're welcome. Also, familiarity with terminology and the use of inclusive language for all materials associated with healthcare communications. That's emails, that's intake forms. Consider having a line that says, gender assigned at birth, current gender identity, things that would let you know to pay attention to the needs of that patient. And then, of course, making sure that you create a safe and supportive clinical environment, which everyone is aware of people's preferences, people's identities, and is sympathetic to that and is kind to all your patients. And then consider safe zone certification for oneself and all colleagues and staff. There's constantly new information that we're learning, new studies that should be taken into account. So safe zone training is a great way to keep up with the best practices for treating LGBTQ patients. And then affirming care for vascular surgery. This is just, again, not exhaustive, but a quick mention of different risk factors and different risk groups and the vascular diseases associated. So in sexual health, things like gonococcal infections, hepatitis C infections, HIV infections, and syphilis infections are seen at higher rates in gay, bisexual, transgender patients and are associated with certain vascular diseases. Of course, HIV infection is associated with a whole host of vascular diseases, You shouldn't assume that all of your patients have exposure to these viruses or these infections, but you should keep in the back of your mind when you're treating patients that are at higher risk. For social behavior, alcohol use, cigarette use, cocaine use, and methamphetamine use are seen in higher rates in LGBTQ patients than in non-LGBTQ patients. So keep that in the back of your mind and be aware of the vascular diseases related to those social behaviors. For physical health, a higher BMI is seen in lesbian patients compared to non-lesbian patients, and it's related to peripheral arterial disease. And then estrogen use. Many of us are familiar that hormonal use or estrogen use is related to venous thromboembolism, but keep that in mind that if you have a transgender patient using estrogen, that could be something that you need to be aware of. And so in summary, it's just important to stay informed with terminology and general information pertinent to LGBTQ patients, best practices, and specifically trans patients, as they do have a lot of needs. And specifically for trans patients, interaction with medical personnel can be something that is worrisome or stressful, or in the past has been abusive or harmful for them. So it's important to take that into account when you're interacting with your trans patients. And also learn about vascular specific needs of trans patients. Just because you're a vascular surgeon does not mean you will never have a patient that is trans or non-binary in your care. So you should be aware of all of these things. These are the references I used for my talk. And I thank you for your time. If you have questions, feel free to reach out to me and I'd be happy to answer them. Thank you so much.